not fully formed, so that you can come out of the birth canal. It can collapse, so for you to come out of birth canal. And the teeth, basically, because we change teeth, that's why there's a joint there. But more importantly, then there is the little movement joints around in the front of the hip. This one is more useful for ladies who give birth. It will stretch when the baby comes from birth canal. A man don't need to stretch a thing unless you fall down. All right. And the more important things today we're going to talk about are the movable ones, the full movement ones, like the knees, the ankle, the back, and the neck, and all this. All these are movable joints. And what is the purpose of all this joint? The purpose of the joint is to give you a range of movement, motion. That means movement. Which means if you lose your mobility, if you move the movements of your joint, literally you're physically jailed. And for those people who knows what it's like to have an immobile joint, you know that you're actually stuck. You can't actually go anywhere. All right. And I'll emphasize on this later. All right. So before I go into joint pain and all this, the word pain. Before I talk about pain, I would like to introduce to you this word called inflammation. Now, by understanding this word later, when I talk about joint pain, you will be able to connect the dots. So there are two types of inflammation. One is called acute, one is called chronic. What is acute? Acute are actually the good inflammation. Do you know that inflammation is there in our human body to repair, to signal repair? It's like a fire alarm like that. So what happens is, if let's say you get a cut, or somebody take a hammer your toe, or recently my friend just walked into the leg. How many of you ever walked into the leg of a chair or a bed? Wow, very painful, right? The toes. Okay, so when that happens, you'll find that the first thing, after a while, you'll find that the area that is injured will start to swell. It turns red and it's hot and it's painful. Now that is inflammation. That's the fire alarm. It is only with this inflammation where the body releases inflammatory compounds. Then the leg will swell, right? Or anywhere of the joints or the cut there will swell. That's where the pain comes from. Inflammation. Now with this inflammation, the inflammation will then activate your immune system to come and repair the spots. Without inflammation, your repair system do not know how to respond. So if you have inflammation because of a cut or a bang or whatever it is, or injury, it's normal. Your body is perfectly healthy. So acute inflammation is good. It's there to help you repair. If you don't get inflammation, you're dead. Right? Now, the problematic one I'd like to talk about today is the chronic. Some people call it low-grade chronic inflammation. They are not triggered by serious events. They are triggered by the kind of food you take. Okay, well, I emphasize to you what kind of food you take. Some of the food you put in, your body goes through 4 to 5 hours of low-grade chronic inflammation. Or you get a little infection here and there, and other things like too much body fat. Too much body fat, you get inflammation, and so forth. Now, stress also, when you get highly stressed, that one I can't help you, fire your boss. That's the only thing I can tell you. Okay, other than that, there's not much I can help you about stress. Now, this kind of inflammation lasts for many hours, majority of the hours of the day. And because it lasts throughout the whole day, it causes a lot of havoc in your body. I give an example. When you have high cholesterol, do not be afraid of high cholesterol, because the cholesterol does not stick. The inflammation causes it to stick. The inflammation causes the production of cholesterol, and the inflammation causes it to stick. Actually, the cholesterol itself is harmless. Okay, so heart disease and all these are all caused by inflammation. Cancer is caused by inflammation. Right? It's one of the causes of cancer is inflammation. So chronic inflammation is what you do not want. But guess what? A vast majority of the population is suffering from this, and I will emphasize to you. And inflammation is like MSG to food. It just if you have any pain anywhere, it just make it more painful. Okay, so that's how you connect inflammation to pain. So how do you know you have symptoms of inflammation? Body pain, here pain, there pain. How many of you have experienced this? Your old parent, leg pain, back pain, here pain, there pain, send to see a doctor. Doctor check, nothing wrong. Give painkiller, go home. Have or not? Have, right? That's inflammation. That's why nothing wrong. The only thing they can do is give you painkiller. And What's another name for painkiller? It's called anti-inflammatory. Just lower the inflammation, the pain goes off. Okay, so it's inflammation is a very important word that you need to understand. You go and Google it, you go and study it. The inflammation must be prevented. Okay, so back pain. Okay, you get fatigue, you get sleepy, or cannot sleep. All right, you have a depression issue, mood swings, and then sometimes all of a sudden cannot control the weight. Okay, besides aging, besides the food, also cannot control the weight. That's why weight management is such a complicated subject. Okay? These are symptoms of inflammation, right? And what causes inflammation? It can be an autoimmune disease, very common. It can be an acute inflammation. It can be consuming excess alcohol. When you consume excess alcohol, it gives you low-grade chronic inflammation. So those people who loves alcohol and you're drinking, we're talking about excess. We're not talking about a social drinker. Once Christmas, go and grab a glass of beer or wine. That's not the excess drinking. I'm talking about every day after work, go down beer. Every day must have wine. Hard liquor. Those are excess. Okay, you get inflammation. Smoking, of course. Thank goodness, Singapore, I do not know about Malaysia, but Singapore, we have eradicated quite a bit of smoking from the men. Now, currently in Singapore, statistically, more women are smoking than men because men, we stop them at national service. They can't smoke in uniform. Right? Chronic stress, when you're stressed up, you can you get inflammation. So you know that when you're stressed, whether it's a family stress, something happened in a family, or whether it's work, when you produce a hormone called cortisol, you get inflammation. This second last one is very irritating. Not exercising enough or exercising too frequently with maximum intensity. Now, it does not mean the exercise is good. The more you exercise, the better it is. There are people who do marathons every day, There are people who do HIIT every day, lift weights every day. It's not always better. You get body inflammation. And when you get inflammation, those bodybuilders those people who suddenly go and lift weights, go and do HIIT, suddenly you go for blood test, your cholesterol shoot up. Why? Because inflammation, the liver will produce a lot of cholesterol because the body is going through stress. Okay, so moderation is the key. Okay, and of course, having a high body mass index, high body mass index is a diplomatic word. The non-diplomatic word is called pui, fat. Okay, down here I can say, go US, I must say high body index. In Singapore, I can say pui, fat. Okay, so we are overweight, inflammation happens. It's also one of the causes. Okay, so let's talk about the pains that I promised to talk about. Let's start with back pain. The back, the back pain, it can come from the whole spine, right? So, as far as back pain, what causes back pain? Very simple. And when you get a back pain, especially in the lower back, please do not take it too lightly because it could be non-mechanical. Non-mechanical means it could be kidney stones. It could be a cancer. Okay, especially lower back pains, and if it's too often. And of course, then you can suspect once in a while, heavy lifting. If you tend to do heavy lifting, you're not using your legs, you're using your back, you tend to get into this issue. Or you pato these are the lonzon people always trip and fall one. And poor sitting posture, I see a lot of this. Frequent bending forward. How many of you know somebody who's always bent and looking at a handphone? Do you see this very often in the train system, the public transport? The neck will get it. You know somebody who has a neck issue? Very common, isn't it? All right. And of course, degenerative conditions. Now, happens very, very often to the older folks. It's aging, degeneration, everything collapse. The only thing you can deal with is exercise your muscles, put in proper nutrition. Of course, these are what we call the layman's term. And then what am I doing? Then we have the scientific terms like herniated disc, slip disc, disc degeneration, osteoporosis, the bone degenerating, also can infection. Some people, very rare, very, very rare, you get an infection of the spine. Okay, very rare. Abnormal shape of the spine, you get pain, inflammation of the back, blah, 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 cancers of various kinds, posture related. So there are many, so it's that complicated because there are many causes to pain. That's the reason why doctor, after a while, if it's not anything serious like a cancer or a slip disc or an osteoporosis, they'll just give you a painkiller because there's nothing they can do. Okay, there's not much you can do, right? So let's talk about slip disc. This is a subject that's very close to my heart. Let's talk about slip disc. Now, first question, how many of you know somebody, besides myself, how many of you know somebody who has a slip disc? Give me a 1, 1, 1, 1. You know somebody, besides myself, you know somebody who has a slip disc. Let's take a look at how common it is. You see the number coming in? That's how common slip disc is. People don't tell you only. If I go out, I don't tell people I have slip disc, nobody will know. Okay? So, slip disc also different male and female. We are in Singapore. We only have two genders, male, female. I'm not going to talk about the rest of the genders. Okay? Depending on whether male, female, there are different statistics. I do not have the statistics, but apparently there's a difference. Lifting, your weight, your body weight, all right, too much weight. You know, when you have a very big belly, do you know when you sit down, your pants will pull your back? It's very painful, you know. Repetitive spine action, sedentary lifestyle. When you're not exercising, you're not exercising your spine. You're not exercising the muscle supporting the spine. And when you need your muscle, it is not there to support the spine. Your spine carries the weight, the whole thing will come off. Okay, and of course smoking. Smoking is related to everything, right? This is the obvious one. And so as far as a slip disc is concerned, this is a normal disc. This is a bulging disc, it bulges outwards. This one bulges inwards. That's the painful one. All right. Actually, this is inwards, this is outwards. Yeah, this is actually human being, our spine look like Godzilla like that, you know, our back. If you take away the skin, we look like Godzilla like that, you know. Their spine like this is outside, and of course degenerated disc and thinning. All right. So as far as slip disc is concerned, what happens is when you have a herniated disc, it pops out like this. There's a nerve that runs down your spine, and then these nerves kind of spread out with little legs like this to go to your arms and your legs and your nether regions, the tips of your finger to your head and all this. So this entire nervous system, if your herniated disc hits one of the side, then one side, if let's say your herniated disc is on your back here, the top of your neck here. Some people, their arm goes numb, or they have a painful arm, they get tingling, they have arm numbness. You go and see a doctor, they will do a diagnostics on you. They will try and give you vitamin B12 first. Maybe it's a nerve issue, so vitamin B12 serve nerve issues. Then if that doesn't go away, you see them again and again. They'll say, let's go for an X-ray, let's check the spine here. They suspect herniated, so that one is slip disc of the neck. More common, the slip disc is at the lower back. The lower back towards the tail there. And when it hits, it goes down. So I'll show you a picture of this one, this herniated disc that hits a nerve on the leg. Once it hurts, the whole leg either turn numb or the whole leg hurts. Okay, all the way to the heel, the back of the leg. Your buttock hurts, your thigh hurts, your ankle hurts, everywhere hurts. Okay, it's called one side. Okay, it's called herniated disc. And I suffer from this at age 21. I was diagnosed personally. That's why I say it's a very important subject to me. I was diagnosed with slip disc at age 21. Why did I get a slip disc? Because in the army, I was trained in this weapon called a 120 tote mortar. Okay, it's a mortar. This mortar itself is 421 kilos. The bullet, or we call it a round, is 15 kilos a piece. Imagine the officer say, 20 rounds, fire off, tapong, tapong, tapong. A lot of exercise, We had to carry that mortar up and down the hill. So my back gave way. Okay, so that's the end of the story. right? I went to see a doctor, and the good doctor says, okay, you have a choice. So he recommended a few things. Number one, you can go for surgery. You can go and cut it up. Most probably he will he will cut away the soft gel there, and then he will fuse my spine. But his answer to me, and I asked him what are the risks. He said if something goes wrong in the surgery, the risk is paralysis. I say paralysis of what? Well, since it's that disc down there, paralysis from the waist downwards. Well, in my head, I say, wow, my two legs can paralyze, but my third leg cannot paralyze. Okay, for those people who are slow, you do not know what third leg is, please go and ask somebody later. Don't make me explain. Okay, so very scared, cut, can go paralyzed. So I chose not to have surgery. So I asked the doctor, I was still very young. So the doctor said, well, you can go for physiotherapy, which I took up. Physiotherapy, pretty effective. And then when it really hurts, I go to the doctor, they'll give me an injection on the back to relax the muscle so that the muscle do not tense up. Once the muscle tense up, it will push the disc further. So they relax the muscle. They also gave me a strong painkiller. We call it the blue pill. Not for massive erection. That blue pill is one of the strongest. It's for surgery one. I took the blue pill, and I was told any pharmacist or doctors down here, this blue pill, the side effect is pretty serious. Okay, there are pretty serious side effects, so don't take it too often. Naproxen or something like that. I don't remember the name. Right? And he says, well, you can also, then at about 37, I gained a lot of weight. The doctor say, go and lose some weight, go swimming. Lose some weight and go swimming. So I decided to lose the weight and too lazy to go swimming. Okay, must change to underwear to swim, cannot. And most importantly, the doctor said, don't be hero. Why don't be hero? Don't go and hero see the pretty girl, go and help them carry luggage. Okay, 不要逞强 cannot means cannot already. Don't go and go hero, go and carry things. Okay, so you don't usually see me carrying things. Okay, I don't like to carry things because of this. So go holiday, no choice. My 43 kilo wife, and the luggage is heavier than her, I have to carry, no choice. And her luggage always heavier than mine because she got everything inside. Okay, so try not to carry, that's very important. So that was me when I was 37, peaking at 92 kilos. Some of you may have seen me in this state before. You see the water retention was pretty bad. I had borderline high blood pressure. I was snoring very badly. I did not hear my own snoring. My wife accused me of snoring. I just decided to believe her. She said the bed will vibrate when I snore, right? And she also said that when she's in the lift together with me, she can hear me breathing. Very heavy breathing. I was on painkiller. I was on injection. And do you know what's the most demoralizing part? The most depressive part is I use my car as a wheelchair. I can only walk one bus stop distance. I can only walk from one bus stop to another bus stop. I had to sit down. I had to sit down. And that year, I was in US and I had a slip disc attack. I was in US alone. I had a slip disc attack and I was queuing for products. Scary or not? Okay. Now, imagine just going to NTUC to buy things, going to supermarket. I drove a car there, and it's like 5 minutes walk. I had to drive a car. I can't walk. If I can walk there, I carry things I cannot carry back. So I had to use the car. And very often I have to say, hey, Glenda, can you accompany me? Or ask my son to accompany me to go and carry things. And my son was very young, so mostly Glenda Kanala. So this year I'm turning 58. I'm 70 kilos and I only have slip disc. Everything else is gone. I have not had the pain for as long as I remember. I don't remember. After I lost the weight, I've never had the pain before. Okay. And of course, the lady down there happened to be a customer of mine. I took picture with her because she was diabetic for 24 years. I helped her lose weight. Everything went off. She's not diabetic anymore. The doctor got a shock of his life. Okay. So these are important things. Weight is the key thing to do. Okay. Now, let's talk about knee pain. So you know about back pain and all this. Let's talk about knee pain. Now, remember, if you have inflammation and you have a slip disc or you injure, you pull a muscle or something, it's just going to make your pain worse. Just remember inflammation. Later, we'll talk about how to deal with inflammation. Let's talk about knee pain. Anyone know somebody with a knee issue? I was at a supermarket just now, and I was looking at some old folks. They were all limping. You notice they're either walking very slowly or see some of them limping. Have you seen them climb staircase before? If they climb staircase, you don't see it. You ask them to climb down, you will see it. They will go down by the side. They cannot go straight down. Okay, so that's knee pain. It's more common than you think. Okay, even among young people, it's more common than you think. Okay, sometimes I ask them when they're overweight, I ask them, after a while they say, actually my knee hurts when I climb staircase. Say, there you are. Okay, so for a healthy knee joint, your meniscus and the fluid down there is perfectly healthy. When you run, you walk, you jump, nothing happens. Then you begin to have a progression of, osteoarthritis is a name for wearing out, your joints wore out. Okay, when you have knee pain and you go and see a doctor, the doctor say you don't have osteoarthritis. It just means that your osteoarthritis has not surfaced yet. But if your kneecap is constantly hurting, it's already starting already. Okay, there's inflammation there. That means your body is saying that when there's inflammation there, something is torn there. Something is worn out there. Okay, so do something about it. So osteoarthritis is the wearing out. This is the most common contribution of knee pain, wearing out. Rheumatoid arthritis is another one. Rheumatoid arthritis is caused by an autoimmune system where your immune system attack your joints. Very often those people with advanced rheumatoid arthritis, have you seen or not, the hand go like that? Those old people, the hand, they cannot hold, they cannot turn their finger is all slanted one side. You go and see, these are rheumatoid. And when you get it on a leg, it's very painful. It's painful 24 hours and this one is autoimmune. So this one, you got, any pain involved, go and see a doctor. But there are two types, okay? So rheumatoid, very often genetic and very often age-related. Osteoarthritis, very often age-related. At the same time, it depends on how you use your kneecap, how overweight you are in your younger days. All right. So the most effective way to reduce osteoarthritis is basically to lose the weight. Now this picture here shows this lady is same height, but you notice this. I was flown to Trisakti School of Medicine to give training to about more than 10 years ago. A school called Trisakti School of Medicine in Central Jakarta gave me a call in Singapore. They said, we heard about you. Can we fly you to Jakarta so that you can train the doctors how to teach people to lose weight? I said, okay. I went over. Wow, all of them overweight, man. All the medical doctors, the lecturers of the university. So I was lecturing halfway when one of them put up the hand and say, Mr. Lim, you forgot to say something. He said, can you take a look at this kneecap here and look at this kneecap here? Our body is not designed to take this weight. It will collapse. And when it collapses, it will hurt. And he says, that's the reason why kneecap surgery is getting cheaper nowadays, because of mass production. Almost everybody goes for kneecap surgery. But it's more common than you think. So for all those who are in Asia, your BMI should not go more than 22.9. BMI 22.9, you should not go any higher than that. Okay, that's given by our Health Promotion Board and Asians as a in general sense. At 22.9, do you know you're supposed to look like a monkey? Everybody's supposed to look like a monkey. But when you look like a monkey, what does your mom and your friends say? Ayo, too skinny already. Stop. Must put on a little weight. You know how I answer them? I will usually say, enough, because I lose weight because I want to get rid of I do not want to have knee pain later. And usually what they'll say, oh yeah, I have, This conversation always lead to a kneecap hurt, knee hurting. I'm talking about angmo knee, KNEE, not tenglang knee. Okay, here. Okay, so weight, get rid of the weight, it helps. Do you know that every kilo you lose, you remove 4 kilo of pressure on your knee? Every kilo you lose, you remove 4 kilo of pressure off your knees. That excludes your jumping situation. If you jump, it's even more. All right? So that knee is taking everything. You wake up, it goes to your knee. You go toilet, it goes to your knee. Everything goes to your knee. So please, the very important strategy is get rid of the weight. Now this is a statistical number of years live with disabilities, knee pain, of osteoarthritis, worn out joints, attributed by BMI. That means attributed by weight, being overweight. Okay, this was done in 2019. And you can see this blue one for the younger people, this orange one is for the older people, and these are the middle-aged people. You realize the older you are, the longer the bar. Let's take a look at ourselves. We are called Southeast Asia. 10.8% of them of what called osteoarthritis caused by BMI is 10.8% for young people. For the older folks is let's see, Southeast Asia is over 16%. 16%. Okay, so that's every 10 people, about 1 to 2 of them has an osteoporosis issue. Osteoarthritis issue because of weight. So that's quite a big number. All right. Wait, how come this one disappear? Okay, this is supposed to be, I don't know why this one doesn't come out, but correct, come out already. Gout. Let's talk about gout. Okay, now knee pain, osteoarthritis is one way. Rheumatoid arthritis is another way. It's called wearing out the joint, but gout is another one. Okay, let's talk about gout. Gout is one of the many joint diseases. So about 4 to 6% of the population suffer from gout. Anybody know somebody who has gout? Anybody? Give me a 2 if you know somebody who has you know somebody personally who has gout. Give me a 2 if you know somebody who has gout. Let's see how common it is. I do. My father, my 2 brothers has gout. I don't have it. It's very common. It's called, why is it common right now? Because in the past, it's called rich man's disease. Because if you don't have enough food to eat, you tend not to get gout. You have too much good food to eat, you tend to get gout. So today, everybody rich, right? So that means every time somebody say, I've gout, you say, congratulations, you're damn rich. Okay? So, and gout is very scary. Why? Because when it hurts, let's say, and most of the time the gout attack is on the big toe here, most of the time. By the way, gout also correlate to the amount of pressure you put and gravity. Okay, and guess which part of the leg takes most gravity and most amount of weight? This one. Okay, most often gout happens here. And I was told, I don't have gout, I was told when the gout happens here, let's say you put a blanket over your leg, and you on your fan blows the blanket, it hurts. It's that bad. Okay, I've never had gout, touch wood, I will not have it. Okay, and I've heard of people crawling to the toilet because they cannot walk. You cannot go to work because of a gout attack. Is that serious? Now, what is gout? Let me share with you what gout is. Okay, we have different type of gouts, and we have asymptomatic gout. That means not so much symptoms yet, or once in a while you get it, accumulation of too much uric acid, and before the first attack. That means when you go for a blood check, uric acid on the high side, that means not yet feel the symptom yet, no pain yet, but the doctor say your uric acid very high, you better be careful. Okay, what do you do in such situation? Okay, we will talk about it in the next few slides. Okay, then we have acute intermittent gout. Once in a while, every 2 weeks, one time, every 1 month, one time. Okay, cause pain, swelling, stiffness, and all this. Okay, then we have a very advanced gout where the gout is so advanced that it causes your joints to be damaged. This one, the pain is perpetually there. You can see the joints are all swollen. It looks even more hideous than rheumatoid arthritis. The one lump down there, literally one lump down there, on the finger, on the legs, and all this. Those are very serious. I mean, they did not deal with it. The crystals formed by the uric acid has damaged the joints. That's how serious it is. That one, no U-turn already. That one. Down here can U-turn. Down here maybe. Down here totally no U-turn already. Okay, so What is the major cause? And this is everybody knows. You put purine in your mouth, it goes inside your bloodstream. Purine produces the most uric acid. By the way, as long as you're consuming things that's protein based, even plant proteins like soya, a little bit of protein, as long as you consume protein, okay, the protein get digested, it goes to your liver. Your liver metabolizes it into amino acid to put into your bloodstream. That metabolism process produces a byproduct called uric acid. That means your body will produce uric acid if you consume protein. You don't consume protein, your muscles will not grow. You will shrink. Your muscles shrink, you will put on weight. It's a very ironical situation. And those food that has high purine tends to cause more gout attacks than those who have less. Okay, so you can eat some of the protein, not every one of them. Okay, so this is where it happens in your intestine, where digested, the liver metabolizes the uric acid as a byproduct. So what is the key word here? The key word here is you cannot stop the production of uric acid if you eat protein, whether it's plant or whether it's meat protein. But the key here is you got to get your body to get rid of it. That's the key. And when your body cannot get rid of it, that's where the problem starts. Okay, now listen carefully. You cannot stop the production of purine. It's a byproduct of amino acid metabolism. You can't stop it. But the key word is having your body to discharge it. Okay, so how does your body discharge? It goes to the liver. Your liver put it through the kidneys, and it will go inside your nephrons, will filter out the protein so that your protein will continue to recycle back into your bloodstream. And the uric acid is supposed to go through all these tiny filters, and then it comes out, go through a urine, it comes out. You're supposed to pass it out. But when this filtration system is under stress or damaged to a certain extent, your uric acid may not be filtered out. It may be retained inside, and guess what leaks out? Protein leaks out instead. Okay, you go and got a lot of bubbles, Okay, but once in a while you get bubbles in your urine, normal. But if every time you urinate, you have bubbles, you go and see a doctor. Okay, your albumin is leaking out. So anyway, when somebody has gout and you are not filtering out the uric acid, it just tells me your kidney is under stress. So you have not been taking care of your kidneys. That's all it tells me. Okay, if you have a gout, you have high blood pressure or a combination with a high blood pressure or diabetes, matter of time your kidney will fail. I mean, if you live long enough, not immediately. These are just indicators. So two conditions for uric acid leaking from kidneys back into the bloodstream. Excessive amount, you have excessive amount, eating too much of protein. Your nephrons, these are called nephrons, the filters are damaged in the kidney. The two reasons. And when the uric acid is not flushed out is in your blood system, it becomes too thick. It forms crystal like this in the microscope in your joints. And this crystal look like needles, it hurts. Could you imagine you put steel needles in your joints and you walk? And this is the microscopic view of how the crystal looks like in your joint. It's damn painful one. Okay, so don't play a fool with this, and you get inflammation. All right, so this is how it looks like, if you want to see all this. There's a lot of things going on in your kneecap when you have crystals inside there, all your immune system, inflammation, everything all there. Okay, so the key word is to reduce uric acid production and increase uric acid discharge to solve this problem. And anti-inflammatory, that's your painkiller. Or supplements which are anti-inflammatory also can. Okay, but supplements slow. Drug anti-inflammatory fast. Okay, so this is, I'm not going to explain to you what this is because I don't understand what it is also anyway. Just to impress you with a complicated picture. Okay, so those people who have what you call gout also high uric acid they have a higher tendency, not confirmed, to grow kidney stones. Also very painful. The back pain is also very bad. Kidney stones, Okay, this is what happens when your gout becomes very advanced. You see these lumps? This is how it looks like. This one cannot reverse already. It's there. And some people have all these crystals in the ear. Okay, okay, and I'm pretty sure some of you are touching your ears right now, trying to feel for stones. Huh? Okay, so this is a very advanced gout situation. Okay, so what causes all this? Red meats. Reduce your red meats. There are a lot of proteins that you can take, and one of those, I know some of you love beef, wagyu, walama, must eat all these kind of things. Their purine is pretty high. So the red meats. A duck is also red meat now, by the way. All right. Now, anything that has huge, very tasty one like the sardine, the anchovies, the codfish, all this seafood contains a lot of purine. Okay, you want to punish let's say your husband scold you, right? And he has gout, right? You want to punish them, quietly stir some anchovies sauce into his food. The next moment he cannot walk. Very fast one. That's how you take revenge, Scold me lah. I got a friend, he say, you scold me. Then the curry, the fellow go and put soya bean, what you call soya drink inside. Stir. Scold me lah. Then the next moment cannot walk. That's how she don't scold back on. She just put soya milk inside the curry. Finish. Okay. Organ meats, of course. Organ meats a lot of purine one. Huang kam cai solid Cannot eat huang kam cai. You miss the part of the world. Alcohol. Now, if you have gout, the very first thing you need to go out unnecessary food is alcohol. Okay. You go and drink, I can't help you. Okay. Shellfish, prawns, squids. That's literally everything cannot eat, That's literally everything cannot eat, Very painful, Your beans also cannot eat. Your coach said, you cannot eat all this, then eat beans for protein. Beans also cannot eat. Confirm, go outside there, chew the grass already. That's why gout is so sticky. This one cannot eat, that one cannot eat. And then, but you gain weight because you cannot grow a muscle, right? Then the coach said, but you have to eat protein and gain muscle. Very sticky situation, right? So you need a trained coach to be able to help you with all those, Okay, some of the seafoods you want to take off, like anchovy, codfish, haddock, herring, mussel, mackerel, literally don't need to eat seafood. Okay, I think we should change down here. No need to eat seafood. Okay, next. I think only sea cucumber can eat. Okay, and then down here also can say don't need to eat meat. Literally everything. And down here also no need to eat vegetable. Then you name the whole thing. Don't need to eat food. Drink water. Pitiful or not? It's very pitiful one. I got a friend who eat tomato also explode. The gout explode. I don't know what he survives on anyway. So it's just terrible. Okay. So people say, then don't worry. I eat Japanese cooking or vegetarian because Japanese cooking very clean. I don't eat the seafood But let me tell you something. I used to teach 15 years ago. I used to conduct cooking class for Japanese cuisine. I'm very well versed in Japanese cooking. Do you know what they use in Japanese cooking? They use dried sardine. They use bonito. They use seaweed. These are their MSGs, and these are purine loaded. That's why you go and drink the soup, the Japanese soup, the pung explode. And you say, I did not eat seaweed, I did not eat seafood, how come also explode? Because the seasoning they use for their oyakodon, their miso, everything, they use this. If not, there's no Japanese flavor. Chinese vegetarian food, soya, gluten, mushroom, also kena. Okay, so do you know that have anyone heard of the word umami? Anyone heard of the umami? If if you have heard of the word umami is derived from high purine food. Only high purine food has the umami. So I'm sorry, you have been if you have gout, you are destined to eat non-umami food. Okay, which Umami food is where all the Michelin restaurants are very good at. All right. So, gout issues, huh? How to solve gout issue? Step 1, lose the weight, the fat weight. As even when you are slim, you have high body fat, lose the fat. Okay. When you gain weight, okay, you get kidney damage through diabetes, high blood pressure, leading to uric acid accumulation. Everything is interlinked. Okay, lose the fat weight. That's the first thing. There's no advantage being overweight except that you look rich. Hock Siong, you know Hock Siong, Fu Xiang. Besides looking rich, there's no other benefit. And why you want to look rich? For the old people to praise you for being Hock Siong? No need to look rich. Okay, Jack Ma does not look rich, but he's very rich. Dr. James Xia does not look rich, but he's extremely rich. Tan Jun Wen does not look rich, but he's very rich. Okay, so you don't have to have a round face to look rich. Huh? Please tell your old folks, no need already. That's last time. Today, the rich people all buy car, cannot walk. All right. So, Xiao Wen was asked about tomato. Tomato increase is not about the seeds. Tomatoes umami increases, the puree increases as it ripens. So the very ripe, I like to use very ripe tomato, even those are a bit spoiled already, soft, to make soup because umami is very good. The young tomatoes don't have much umami, it's the very ripe ones. Okay. Reduce the purine food, which is the meats. Okay, now this is the one that the hospital almost never tell you, cut the sugar. You know, my brother used to have gout for 20 years. So he has been seeing the doctor. I've been in this business for also about 20 years. He never asked me. He don't believe in me. So he going to see a doctor. Then one day he said, oh, nowadays my gout comes every month already, even despite the drugs already. Once a month kena. So tell me the secret. I give up already. After 20 years, I decided to ask you because I don't know why you don't have gout. Because it's supposed to be genetic. Everybody has it except you. So I said, are you ready to listen? He said, yes. So my answer to him is, cut your sugar. He said, what? The doctor never tell me to cut my sugar. He said, cut all the seafood, intestine, all this. I said, cut your sugar. So he don't quite believe me. And that was just a few days before Chinese New Year. He actually flew back from China to have reunion dinner with us. So during the reunion dinner day, he called me up and says, brother, I cannot come already for your reunion. I said, why? Gout attack. I said, why gout attack? Then he said, brother, you're very good. Now I believe you. I said, what happened? Oh, in order to test your theory, I went to buy a bottle of Snapple. I drank the whole bottle of Snapple. In 2 hours, my legs swell up. So you are right, it's the sugar. I said, wow, you very KL, huh? You don't believe me, you have to test on your own body. Huh? Actually, 2 hours, he drank a bottle of Snapple. In 2 hours, he was limping. So what is it about sugar? Processed sugar causes inflammation. It makes the pain worse. Number 2, research found that sugar reduced the discharge of uric acid through the kidneys. That's why sugar is a culprit and nobody noticed. Those people were gout sugar. And sugar is not just the white sugar I'm talking about processed carb. That's also sugar. Okay? And of course, the best way to do it is to dilute. If you have high uric acid, make sure your blood is diluted. The very moment you get dehydrated, the crystal will form. After a while, the attack will come. Okay, hydrate. And when you hydrate, please do not drink those kind of water. Make sure it's best you drink tap water or mineral water. Huh? Don't drink those kind of water there's no mineral inside one. Huh? No use. Huh? Cannot retain your water in your bloodstream. Okay, so at the end of the day, what's the best option? Lose the weight. Have any one of you heard of a friend who decides to go for kneecap surgery? You ask them to lose weight, they don't want. Then they decide to go for kneecap surgery, and the doctor say, before you go for a kneecap surgery, can you lose 5 kilos? Have you heard of this before? He don't want to lose weight, but he want to go for kneecap surgery. But before kneecap surgery, the doctor asked him to lose weight first. Back to square one. Why? I put in the new kneecap for you, I do the surgery for you, you're still equally healthy, you put the weight back, it won't last very long. The doctor will tell you go and lose weight. So end of the day, the best option is to lose the weight. Okay, is to lose the weight, end of the day. That's the best option. Okay, and we have been doing this program for 17, 18 years. Okay, it's called Project Glow Up. The Mandarin is called 在肚子亮在脸上 So what it consists of is of a program, of an eating plan, and exercise plan. If you cannot exercise like me, I'll teach you how to move your muscle, or your coaches will teach you. If you can exercise, go ahead, right? And then we'll teach you an eating plan. No hunger is allowed. It's not a diet plan, it's an eating plan. This too is what we will teach you for 3 months, hoping that you will become a habit, all right? And we will use a set of products, supplements, to support you for 3 months. So the supplement comes in a form of a support, all right? In terms of insulin management, return to youthful metabolism, increase your metabolism to burn fat, to retain muscle, to block the sugar and carbs so that you don't get all those attacks again, caloric management and reduce rebound. So the product is there to support you for 3 months. But during the 3 months, our job is to train you and teach you, bring down your weight through a set of habits that you can maintain for a very long time. So that's the program that we've been doing for a very long time. This is Mark. Mark suffered from gout. I just brought out 7.5 kilograms of fat. He was literally crawling. Today, his gout, wrong spelling. Today, his gout is gone. And he's eating seafood at will. He said, it's not the seafood. I say, yeah, I told you it's not the seafood, it's the sugar. He said, nobody told me about sugar. They just asked me, no intestine, no seafood. I live like a monk for how many years? Okay, so I say, you get rid of your weight, you can start eating seafood, no problem. Okay, Alan To also suffered from gout. His gout also removed, gone. This lady, she had 2 heart attacks, was on 14 types of drugs. She suffered from stiff, numb and painful leg joints, her kneecap. She cannot, literally, she was not walking. She hasn't gone holiday for a very long time. We pulled out 17 kilos, left 4 types of drugs, and she was walking. Do you know, after she lost weight, she went on a holiday spree because she said, now I can walk. That's why I say go to jail if your joint pain goes off. And then we have somebody who was, I show you this one, 24 years of diabetes, oral medication, insulin. Today, 75% of her medication has been removed, injection removed. And the doctor say, actually, you're not diabetic anymore. 24 years. 24 years. It took the doctors 24 years. It took us 90 days. End of the day, the doctor was right. The doctor has been telling her to lose weight, but she cannot get rid of it. Come to us lah. Simple. Okay. This one is PCOS. PCOS is called, got Mandarin translation, Joel, you read yourself. It's called polycystic ovarian syndrome. Okay, the ovaries, a lot of polyps one. Now, some signs of inflammation because of PCOS, you get migraine, joint pain, acne, fatigue, weight gain. Look at the weight, look at the stomach. Autoimmune disease. I pulled out 8 kilos in 90 days. And she had all these symptoms disappeared. Okay. So she actually asked the doctor, PCOS, what drug can you give me? The doctor said, don't have. The only way to deal with PCOS, lose weight. Only after she has lost weight, her friends start coming in and realize PCOS, very common. Any one of you know somebody who has PCOS? Give me a 2222 if you know somebody who has PCOS. The ladies don't usually talk about it, but it's very common. Give me a 2222 if you know somebody who has PCOS. Okay. According to her doctor, the only way to deal with it is to lose the weight. And she did after many years of trying. Diabetes. This is weight loss, and the doctors know. The doctors say go and lose some weight. So she came to us, brought it down to 5.7. Now, diabetes is caused by inflammation. Inflammation is also caused by diabetes. It's a vicious cycle. Okay, and when you have diabetes, you get inflammation. When you get inflammation, everywhere hurts. And one of the things that inflammation causes is cancer. Okay, cardiovascular disease, and so forth, right? So inflammation is the keyword. I cannot emphasize enough of this word. Okay, this is Arlene. 18 years of high blood pressure. It took us 30 days to bring down the blood pressure. And then finally she said, oh, so it's the food, huh? I said, but then, okay, so her blood pressure is gone. Um, or even if you are not sick like this person, her only sickness is she wants to be very pretty. Okay, she used to be a branch manager of the largest slimming center in Singapore. That's all she could do. She came to us. We brought it down. Today, this picture was taken a few weeks ago. She's 58 years old this year. Nice or not? 58 years old. Son is already 24. That's Elaine. I think she's also inside here. All right. So let me tell you about this system called Project Grow Up. So there are two parts of it. The first part is a set of products. Okay. This set of products, you use it for 90 days. It's designed to support you through a program. And during these 90 days, one or two coaches will be attached to you to do what? To impart an eating plan without hunger. Okay, that's the important thing. We need to impart an eating plan without hunger. Most of your result is because of an eating plan. And please, don't worry, it's not about eating boiled broccoli and boiled chicken breast. It's not that. You won't last very long. It's eating normal food, right? And then we will instill long-term strategy. What is long-term strategy? We are going to assume that you're going to continue to go for cruise, Chinese New Year, Christmas, bacang, mooncake, birthday, baby shower, funeral. Also, we eat curry chicken, and etc., etc., etc. Right? A lot of celebration, right? So we will rather teach you strategies how to handle that than to lose your social life. Okay, go ahead and socialize, but we'll teach you how to handle it. And of course, eventually your BMR or your metabolism will take over the product. The product is temporary. Okay. We will Zoom you most of the time, so we highly recommend that you purchase your own body analyzing machine. With the data, the coaches will be able to Zoom you on a weekly basis. We offer to Zoom you on a weekly basis. You can choose not to, right? So we can coach you offline. Especially in Malaysia, when you're living so far away, I think it's worthwhile to have your own machine so that you don't have to keep coming to the office, right? And for those, if you're in Singapore and you're reachable, if your coach is in Malaysia and you're reachable to them, you can meet up with them for nutrition scanning, for supermarket walk, etc., etc., etc. All right. So we teach you a lot of things about nutrition. Okay. So this program is called Project Grow Up, in short, PGU. Okay. So we have a process to burn your fat and build your muscle, and then we have a process to treat your gut system. This gut system modulates chronic inflammation. 70% of your body's chronic inflammation come from your gut. So you need to deal with it to lower the inflammation. All right. Of course, later you can choose to do lymphatic system. It's for skin health. It's for draining out water. It's for cellulite, unsightly cellulite, and it's for shaping. Okay. So these two are very important. The product consists of a speed burner that lasts 2 weeks, incredibly fast. And then we have a food that helps you to feed your muscle. We have something to help you block sugar and carbs, very useful during this point of time. Sugar and carbs, some of it just does not get into your system because you're eating excessively. Yeah? And of course, we have something to manage your blood sugar and therefore your mood. Okay, your mood very good. You won't kill your husband or your wife while you're on this program. Okay. Of course, increase in metabolism and maintain your muscle, we have also. And of course, to deal with your gut. Remember, 要治病先治胃. You want to treat any disease, treat the gut first. And this is a powerful gut instrument for you to use, right? So, here's the announcement. For those people who are not familiar with PGU and would like to attempt it, call your sponsor, go and attempt a PGU. Those people who have completed the PGU already, I invite you to attend something called a PTU, Project Tone Up. The orientation is on the 19th of February. What is this for? This is for this kind of things. If you want shaping, you want to improve your results further, this is May. This one took 30 days. 30 days on PTU. It's an advanced program. If you have not done PGU, please don't do PTU. This is Eileen. Eileen is from Malaysia. She attended PTU 2 years ago and her abs are still very nice. She's 43 years old. Mother of 3. This is mother of 2. Okay, that's PTU. Okay, so condition is you can only attend if you have completed 90 days of PGU. And if you wish to participate, please get your... How come this one not moving? Wait. please, you wish to improve further, or you want to reduce Chinese New Year damage. Some of you got damaged by Chinese New Year. Okay, all you need to do is to invest in 45 days of the TRME plus R square, and then get your upline executive brand director to register with me. The class has a limited capacity. Register with me on and off. Just ask your EBD to don't call me directly. Ask your EBD to register with me. Okay, and I'm about to complete the last PTU class. The next one should be coming. Okay, you just need to do 45 days. All right. So with that, I wish you 蛇年行大运.